Well, thank you everyone for joining. I'm sure more people will join us as we move along. It's 12:01, so we thought it'd be timely to begin the webinar. I'd like to thank you all for being here today. My name is Agustina Gancia. I lead the consumer engagement work as well as the capacity building work that we do here at Health Translation SA. You're joining us for the Spotlight series on consumer engagement today. Before we begin our session, I would like to acknowledge that the Ghana people are the traditional custodians of the Adelaide region. We recognize the Ghana people's cultural, spiritual, physical, and emotional connection with their land. We honor and pay respects to Ghana elders, both past and present, and all generations of Ghana people now and into the future. I'd also like to acknowledge any other traditional custodians and regions that might be represented today, as I think we have people who are outside of the Ghana people's region. We might have some interstate people joining us today as well, and across South Australia. So what is the Spotlight series? It's an initiative that was launched last year in 2021 by Health Translation SA. And it's a capacity building initiative. Essentially, we are trying to build knowledge and capacity for essential research skills to improve research translation across South Australia. And we do this through shining a light for a whole month on a specific topic of research translation. We do that through promotion of resources, online tools, training, and via the webinars, and some publications on our website. Today we've had 3 Spotlight series. We have had one on the MRFF, one on implementation science, and one on research impact. This is our 4th one on consumer engagement. And we're currently planning our 2023 calendar for our 4 next topics. If you have any questions, please put them in the chat. Kate and Cheyenne will be talking to us today. And so I was hoping to have the question session right at the end. So we'll have the 2 speakers, and then we'll have a specific and dedicated question time. Before we begin though, I'd like to just do a quick run through of who Htsa is very quickly. So Htsa is a research translation center, and our purpose is to accelerate the translation of research findings into healthcare practice and policy to increase whole of system research translation capacity to improve the health of South Australians. What that means is that we work by being an independent catalyst and to broker and mobilize collaborations across the whole system. So across health services, research, other stakeholders, and that includes consumers and the community, which is why we're here today. And so research translation is not something that just happens at the end of a research project. It's something that it's a mindset. It's something that you have to think about throughout your research project. It starts from, the research development question. Who's the next user? Who's going to use this research? What's the end objective? What's the ultimate problem you're trying to address? And so that's what we're trying to build and build capacity on across South Australia through Health Translation SA. Specifically, consumer engagement is where we engage the community into research and ensure that it remains relevant for those people who will be affected by the research. But Kate and Cheyenne are going to tell us all about that today. So we're going to be looking at the basics of consumer engagement. What are the foundations? What are the key principles? And what are some key, questions or insights that arise in this work? I'd just like to introduce our first speaker is Associate Professor Kate Laver. She works at the College of Medicine and Public Health at Flinders University. She works collaboratively with health professionals and members of the public to conduct research which is of value. She develops and evaluates non-pharmacological interventions which aim to promote activity and participation and quality of life in older people, and has over 15 years of clinical experience as an occupational therapist. So I will now stop sharing my slides and invite Kate to share her PowerPoint presentation.
And then, hang on.
I'll mute myself as well.
Hang on. Oh, maybe if I go like that. No, from beginning. Hang on. Hang on from beginning, and then I want to. Okay, I'm getting there.
It's always hard with two screens. I always have
right now?
Yeah, that's perfect.
Yeah, perfect. Okay, thank you. Right, thank you so much. Sorry for the slow start, but thank you for having me today to talk about consumer engagement in research. And really, I think, you know, that to sum everything up, none of us is as smart as all of us. Right, perfect. And I think, so one of the roles that I've taken on in the last couple of years has been to co-chair the FIMRI Consumer Advisory Board. And we orientated a new member recently, and I said to her, look, I'm co-chair. I definitely don't consider myself to be an expert. You know, I think we're all learning together. And she said, that's the best thing I've heard since I've joined one of these groups, because I think none of us are experts. We're all learning together. And I think to acknowledge that is really important. So I just wanted to say I'm not an expert. We're all learning together. And I think, you know, I hope that I can share some of the insights that I've experienced today. Just thinking initially about some of the value for researchers in consumer engagement in research is that it gives us more accountability, transparency, and credibility of our research. Consumers bring a fresh and independent perspective to the research that we do, and certainly some of the things that I've envisaged to proceed with the research has changed based on consumer feedback or has taken a completely different direction. By involving consumers in our research, we're able to ensure that we're meeting the community's needs and our policy objectives, so it's relevant to policymakers. And if we involve consumers in research and we conduct a higher quality of research, we'll be more likely to have greater translation of research findings and higher quality of life for our community. So just this work was actually done in 1997, so it's quite old now, but it really talks about the different perspectives that people bring. So they surveyed members of the public, and then they surveyed GPs to find out what makes a good GP. And there was quite a lot of difference. So patients felt it was more important that the GP tells them everything that they know about their illness, that it was possible to see the same GP at each visit, that they could make an appointment with a rapid response time, that it was easy to speak on the telephone, and the GP was quite happy for them to seek a second opinion. Whereas we can see that GPs felt that it was more important in their practice to provide written information about the practice organisation, to have good cooperation within staff at the practice, that they felt it was important that they took a personal interest in the patient as a person, that they were able to coordinate different types of care, and that the same GP was able to see all members of the family. So we can see here that, you know, people have very different perspectives based on their experience. Now, this is we're talking today about consumer engagement in research 101, the basics. This is a key tool that you all should know about. This is the IAP2, which was developed by the International Association for Public Participation. And it really displays the spectrum of participation, so that we can see here that it may be that you're at the lower end of the spectrum, so you're just informing consumers about your research through disseminating newsletters or information. You may be consulting them, so obtaining kind of more direct feedback about your research. And then a lot of the work that I've been doing more recently is really around those involve and collaborate stages. So at this point, you're working directly with people to ensure that you really understand their perspectives and they're considered and incorporated. And collaborate is when you really have, I guess, consumers as co-investigators, co-authors in your research. So they're really, you know, critically integrated into all those aspects. And then I haven't done any research at the empower level, but, you know, I know that there's a lot going on. And that's really where the consumers or the stakeholders are conducting their own research and the researchers are providing assistance. So they're acting more as the consultants or the information providers. And there was a really good paper recently by Knowles and colleagues just last year, and they really fleshed out the process of consumer engagement in research and some of the barriers and enablers. And you can see here that initially a research team might have a preconceived direction of the research. And then as we incorporate patient and public involvement or consumer engagement, we really need to be willing to take that in a completely different direction. So based on this new learning, we can, you know, pursue different ideas or different outcomes or different agendas. And this paper also looked at some of the key facilitators. So the first thing was space to talk. So we tend to, traditionally, when we involve consumers in research, we often tend to have a steering group or an advisory group where we have consumers involved. But they do say that, you know, it can be a more effective form of participation when you're looking at things like mapping activities or workshops or using other visual or mapping or interactive techniques to elicit preferences, ideas, and advice. There's recognition of the consumer or the members of the public or the patient as being an equal expert in the topic. Very important that tensions and disagreements are explored. So it's very healthy to have different opinions. And rather than kind of keep the peace and harmony, it's really good to flesh those out so that we're able to understand different perspectives and see where there is agreement and where there isn't. That's very important. Obviously, reimbursement was enabled attendance and reinforced the person's input, and it was genuinely valued. And in terms of space to change, so they thought it was important that the research wasn't so scripted, that it was possible for the process to be iterative and reactive to feedback, that the researcher followed up with prompts to invite critique. So rather than saying, this is what we're doing, you know, does that sound okay? Really, you know, how do you think this will work? Do you think there'll be any problems with this? So really teasing out different challenges. That the research team were willing to adapt their aims and willing to change their minds, and that there was shared responsibility to collaboratively develop new models. So the researcher team really had to be open-minded and risk-taking when they went into the process. So there's lots of resources that are already available. So I know I've spoken to other people before and they said there are lots of toolkits, don't develop new toolkits. And there are lots of toolkits. So the Involve website in the UK was one of the first in this space. They have a great toolkit. Health Translation SA have really good resources on their website for this, and I encourage you all to see what they've got. And then the Australian Clinical Trials Alliance toolkit is also relatively new and quite useful as well. So when we're thinking about who we should involve, so we talk about consumer engagement, we talk about PPI, you know, who should we really be working with? And so should we be speaking to patients? So patients are the people that have the health problems, and they can really tell us about the lived experience and what could really be done. You know, what issues they're sensitive about, what could be done to really promote their quality of life. Now, members of the public cannot be proxy for patients, so that's really important. Now, carers' lives are also affected by different health issues and caring for that person. So sometimes, particularly in dementia research, we do work with patients, and we also do work with carers, sometimes together, sometimes separately. But once again, carers are not proxies for the patient or the person with the health condition. So thinking about your sample. And then the public also has a role to play. So we talk about deliberative forms of research, so things like citizens' jury or stakeholder forums. And this is where we're really interested in the public or the taxpayer's perspective on a particular, it might be a wicked problem or an issue of concern. And, you know, we might be contemplating, you know, where the priorities for and where public money should be spent. So patients and carers are also citizens, but they cannot be proxies for the public because they do have lived experience and unique perspectives. So we need to think quite carefully around whether we're working with patients, carers, or members of the public. And, certainly there's a role for all of those things. Now, one thing that I often speak to, so I often speak with people about their grant applications, and they'll say, look, I've got a couple of consumers, I've spoken to them about this, I've spoken to them about the recruitment, and I've got in place a consumer advisory board for when the project starts. But one thing that they often forget is to look at all the existing literature on public and patient preferences that's already been published. So you can work closely with consumers, individuals, and you can have groups of consumers and you can hold workshops, but there's lots and lots of literature now that really publishes the uses Delphi techniques or workshops to elicit the preferences and priorities of different patient and public groups. So I think that's a really good starting place in your literature. And there's schemes like the James Lind Alliance, where they have stakeholders involved in priority setting, and they have a specific methodology. So for example, when I'm doing dementia research, I often look at this this guideline or this I think it's a white paper on quality care for people living with dementia, and that was developed as a result of lots of focus groups and interviews with people with dementia and their carers. So it really conveys the voice of the intended population and is a good starting point. The other thing we can do at the starting point is making contact with existing consumer groups or patient forums, holding like a one-off focus group to bring people together and identify most important research topics or different perspectives, reaching out to individuals. And, I often use the Htsa register to connect with people, or it might be through people that, have been involved in my past research projects, or that I've met through networks, or even through people that come through the clinic that might be interested. And the other thing is, we do a lot of, in health services, we get a lot of feedback. So we get complaints, we get, positive reports, and acting on that is another way of really responding to people's needs. Locally, as I said, the community interest register is really fantastic, has lots of people in there, and every time I've advertised something on there, I've got a positive response. And then the LHNs also have their individual consumer and community engagement groups who might be interested in participating as well. Important to think about diversity. So we do know that there are groups that are less likely to become involved in consumer research. So these include people from ethnic minority groups, people who are young and working age, because we tend to have our meetings and our consultations during our business hours, which is when they're at work. Very old people, people with disabilities, people with learning difficulties, people with lower levels of education and lower socioeconomic backgrounds have different barriers to participation. So we need to make sure that we're including a diverse group and have reach to different consumers, and also making sure that we tailor our approach according to those barriers. So if we are working with, if our topic is of interest to working age people, that we do our consultation out of working hours to be able to accommodate that, and making sure that time, transport, and finance barriers can be overcome. I won't talk a lot about payment. There's a lot of guides that detail this. I do think that I'm surprised that people still don't realize that payment is an expectation, and hardly any of the consumers that I can't remember a single consumer that I've worked with ever doing it purely for financial reasons. And people do it for other rewards, but reimbursement is really important regardless. And so for that partnership between you and the consumer or your patient group to be successful, so there must be benefits or equity for both sides. As a researcher, you're paid for your involvement in the project, so they should be paid for their involvement as well. It is considered international best practice, and I guess it's just a material way of acknowledging the value of consumer representation, and does allow a broader range of people to be involved and increase the sense of equity. And we've done a little bit of work with that around how we can overcome some of our normal barriers around reimbursing people and exploring whether they have to declare as taxable income, all those sorts of things. We've kind of worked to make sure that it's as convenient and easy for people as possible to be involved and to be paid. So just quickly, some examples in practice. So a few years ago, we developed the first NHMRC clinical practice guidelines for dementia. Now, we did have consumers involved in the development. So we had a committee of about 20 people, and 5 of those were consumers. So it certainly wasn't 50-50 or balanced, but there was a good contingent, and those people represented people with dementia, carers, people from different, from culturally and linguistically diverse backgrounds. So a range of different perspectives in our consumer group. And then as a result of that, a small number of researchers, so 3 of us, worked directly with those 5 consumers to produce the consumer guide, which was really, I guess, health professionals really are the intended target audience of the guidelines. So we used that information and developed a consumer guide so that consumers would have access to knowledge about what sort of care they should be receiving. And that was much more of an equal role between consumers and researchers. So we have involved consumers in grant applications and co-authoring. There can be some barriers around affiliations, for example, but we've managed to overcome that and have had good success with NHMRC grants with consumers as co-investigators. Taking up that point around having members of the public involved in more visual activities. So more recently, we've been doing workshops where we have different activities to really promote different ideas and different ways of thinking, rather than asking for quite specific feedback on a partially developed research proposal. So really kind of starting from square one to try and get some initial information to shape the idea of the grant. And then we've also done some work around community engagement. So we've used citizens juries for a couple of different issues. We looked at rehabilitation after hip fracture and also consumer-directed care and residential care. So in this, we recruited members of the public. So we had 14 members of the public, and this was held on a weekend, so we could ensure that we had a range of people, including working age people. And the jurors were intended to be representative of the public in terms of gender, age, socioeconomic status, and whether they were living in cities or rural areas. And then we had expert witnesses. So these were the people who already were knowledgeable about the field, and then they present to this group of jurors. The jurors then have 2 days to consider the issue or the wicked problem and reach a verdict. And the idea is really that the findings of this jury represent the public sentiment. So it's a small group, but they're meant to be representative. And that's really good for these wicked problems where you really want to know what the public or what the taxpayer thinks. Great. Thank you. I will stop sharing. Any questions or discussion? I'm on Twitter and email, but I really look forward to Shyam's presentation because he's been doing a lot of work in this field.
Thanks so much, Kate. I'm sure we'll have lots of questions for you after Shyam's presentation. I've made a few notes myself here. Now, I'd just like to share my screen again to introduce Shyam, and then we can go straight to his presentation. If I can change my slide, there we go. So Shyam has a PhD in chemistry and uses his research skills and lived experience of kidney disease as a kidney transplant recipient to bridge the gap between clinicians, researchers, policymakers, patients, and their caregivers. He's responsible for the coordination, implementation, and evaluation of a consumer engagement strategy for Australia, New Zealand Dialysis and Transplant Registry, or ANZ data. It is based at SAMRI in Adelaide, South Australia. So over to you, Shyam. I'm just going to stop sharing, and the mic is yours.
Can you hear me now and see my screen properly? Thanks, Agustina. Thanks, Kate, for the introduction. Sorry, I'm in a shared office. Let me know if you hear other voices as well, which is not mine. I would like to start by thanking Agustina and the team at Htsa for having a spotlight series on consumer engagement, as we know how important it is and how relevant it is in terms of health and medical research currently after COVID, in terms of patient priorities being highlighted across all the areas from research till public disclosure. So bit of a start. I'm Sham, as Agustina mentioned. My journey or my story today is about not only my journey, but also people who supported me in this journey. I was in Australia in 2009 for an ambition in terms of changing the world. That's the whole idea of doing a PhD. But then my world came crashing down when I started my PhD because I was diagnosed with kidney disease. And as anyone with kidney disease know, if you are a patient of kidney disease, you are a patient for life because transplant is not a cure, it's a treatment. But having said that, I started my PhD and then in chemistry, but then I found my passion for consumer advocacy in terms of how do we include patients or consumers like me in research, especially not just tokenistic, but being in an empowered way. Okay, Kate started by saying, none of us is as smart as all of us, but I'm going to take a bit of a different route, saying nothing about us without us, which is essentially saying you have to include the stakeholders, which are the patients primarily, in terms of making any policy decision or even in terms of research, setting a research question, and without excluding us. So this one was coined by disability rights activists in the early 80s. And also, as Kate mentioned, involve means research being carried out with or by the members of the public rather than to, for them, or about them. So it's more about involving them and engaging them in a meaningful way. So that's the whole idea of having consumer engagement. I'm fresh off from listening to the podcast by Brené Brown, Dare to Lead. And if you have missed it, it's a fantastic podcast on organizational psychology. It was most shared the Monday episode, which is with Adam Grant and Simon Sinek, my favorite two organizational psychologists. But in terms of here, you have to start with the why, which is there are a couple of reasons, and the important thing is when, as a leader or as a researcher in your field, finding that why, apart from all these things, like involving consumers brings in so many benefits, like it reduces the research waste because your priorities are aligned with consumer priorities. It improves practices in terms of how do we include consumers or recruit consumers for clinical trials? And as Agustina mentioned, in terms of improve the translation to practice and policies, and it is recommended by across the globe, whether it be involved or whether it be patient-centered outcome research in US or the consumer engagement in Canada as well. And increasingly the journals, as Kate highlighted, have consumers as co-authors in most of the journal articles that are published recently. And NHNMRC and MRFF have specific grants that are not only have consumers as co-authors, but some of them are consumer prioritized, consumer-led grants as well. So if you want to get proper funding and to get overall score, it's really important to have a consumer in your investigation team as a co-investigator as well. And ethically, it is the right thing to do because most of the research in Australia is funded by taxpayers' money. And if you are not involving consumers, it's not ethical. So first find your why, and then as I mentioned earlier, these are the benefits of including consumers. I always have this mentality, which is consumer engagement does not happen by choice. It is a deliberate practice. It happens by choice. It does not happen by chance, because you can't think consumer engagement as an add-on at the end. when I mention leaders or when I see people like in my area, whether it be Associate Professor Shilpa Jesudasan or Professor Stephen McDonald or other Beat CKD investigators, they tried this many times and it's their deliberate practice, which is purposeful and systematic. They do it every day to get it right. So if the leaders out there want to include consumers in their research, uh, you need to have some set of principles, guidelines, and also resources that enables you to do this regularly and not just a one-off thing as well. So it's that's why I coined the term consumer engagement happens by choice rather than chance. And you have to be deliberate about it as well. And that comes to organizational consideration because you have to get the help of an organization. And how do you include consumers? Because often you are bringing someone outsider who doesn't have a research training, or but their voice needs to be heard, and you have to make avenues for them, whether that be HR or a payment in terms of how they are going to get paid. As Kate mentioned, reimbursement is, it doesn't matter whether you're paying them money or gift card, and as long as there are policies in place about confidentiality, insurance, induction into your organization. So that those are the organizational level support that I talked about earlier. How do you engage consumers? And some practical considerations like I'm going to talk more about the role description in terms of reference, but there needs to be trainings and support. So I think Htsa is really well suited in this area in developing a seminar or workshop for consumers to be involved in research across the spectrum and access to resources as there are Htsa kind of toolkit for consumers as well. How do we include in clinical trials? And also addressing the needs of the consumers, because as you all know, some of them are still battling their condition, some of them are survivors of cancer. So it's really attuned to the needs of the consumers. And one of the key area I found it really helpful was pairing up with a buddy who is a researcher or an early career researcher. And when we all come to an organization, often, even though I come from a PhD and a research background, when we move into a medical field or a research in health and medical research, it's a big task to navigate the complex area, especially when you take them to scientific conferences or research grant writing, and also the working with other colleagues. So if you pair up with a research buddy who can help us to navigate that space, that's really helpful. And also availability and where you're going to get your funding from, and a language, how do you talk to consumers in your setting, which is, I'm going to talk more about communication because that's a key area. And also opportunities for consumers to be leaders in their own field or in advocacy, so that they are creating more and more consumer champions as well. So that's the domino effect we can create as well. So as I mentioned earlier, consumers can have a variety of roles within an organization or within a grant as well. They can be, it's like an onion, so you can just have layers, and then people can often move in and out of the layers as well. Some of them you want to be core partners, but that needs more resources and training and funding as well. Some of them can be experts, some of them can be advisors and advocates as well. So it depends on what you want from your group or what's your preference as well. And one size definitely does not fit all. And I say it in terms of not only for your group, but also for your project, and also at what stage of the project you are on. Sometimes you want to have a focus group, sometimes you want to have a co-investigator. So that's why it's really important to build a pool of consumers who are necessarily trained in all these skill set, but also you have a broad range of consumers that you can pick and choose as well. But my dream is to move away from that and also embed consumers in organizations. As a leader, I find this really important to create those leadership roles within an organization for consumers, because without power, there is hard to achieve anything, because the power imbalance plays a huge role. And that's why it's really important from moving consumers from bedside to boardrooms, because I find this valuable from David Gilbert, who runs a program on patient leadership, and he's a fantastic speaker. And he worked with NHS in terms of embedding consumers or patients as directors. And as I mentioned earlier, it's not just one size fits all. You need to have patients and carer forum where you can have a formal committees in terms of hospital settings. And it's a similar in research as well. We can have broader groups of consumer work groups, focus groups, and patient partners in decision making. But we need patients in core areas like that's why I'm so fortunate in work at Htsa, which is they created a role for me as a consumer engagement officer, not only because of my lived experience, but they mentored me, but they trained me to do these roles apart from my research background. So I find this as a, a golden standard in terms of implementing consumer engagement in health and medical research. As I mentioned earlier, if we are going to highlight two areas, that is building better relationship, because it's all about relationship, and relationship takes time and trust to build. For some people, it's easy to happen quickly, but the key area is the quality of relationship. What's the quality of the relationship that you build with your consumer, and also the network or who you connect with, and how we are connecting those network, and how you're maintaining those built relationship with the consumer, and what's the common purpose that underpins that relationship. That's a really key area in terms of because people often overlook these areas, and that's when it becomes so tricky to re-engage with consumers. And that's why take your time and build the trust to become when you form a consumer group or one-on-one training with consumer as well. The other key area I find people struggling in terms of getting the message across is communication, because there are few researchers that I came across who can tell their research in a simple word, or because we are all knowledgeable, but we are all not experts in your field. So it's about how you communicate your research as well. And also body language. How do you approach consumers? What are you genuine in terms of the communication? And as I mentioned, avoid jargons and acronyms, because I sometimes fall in this pitfall as well when I say NHMRC and other stuff, but being sensitive to the consumer needs as well. And also correspondence is really key in terms of how you are going to communicate with consumers, because a clinical trial or research takes a long time, like 5 years. You get a grant for, but you have to keep your communication with the consumers. They have to be in the loop, so that you are not just asking them initially about 100 survey and questionnaires and then not touching back with them after a year, or leaving them for 5 years. And then, so that's why what happens when you don't build a relationship. So it's all about communicating and being timely and having a strategy developed across it as well. And it's more about, I always say, we are more than our disease. As as mentioned, I have a PhD. Some of my consumer advocates are CEOs, managers, lawyers, and they bring in a wealth of value and knowledge and a skill set to your group. So try to learn them as a person and all they have to offer, so that you are not just using them as a guinea pigs in your research. So it's more about approaching them holistically and using their skill set everywhere, rather than just getting their inputs in a particular project. And as I mentioned, some of the key lessons from these ones are, how do you maintain a relationship with the consumer? And learn about consumer involvement in research by doing it rather than deliberating it. As Kate mentioned, there are hundreds of toolkits available, hundreds of guidelines available, but if you don't do it, you don't learn from the mistakes. And also make the involvement for consumers easy in terms of, for example, simpler things like making access to your conferences free for consumers in scientific seminars and symposiums. And also one of the key things we work in terms of kidney research is being like providing some kidney friendly diets in conferences rather than just thinking they will be all happy with your lunches. So it's being mindful of those simpler things that makes a huge difference. And also feedback from consumers is really key, which is what are you doing in terms of how well your system is designed to receive feedback, because feedback is really key, and you should have a no wrong door policy, which is consumers should know who to contact to in the first place. They shouldn't be searching for a huge database. It should be readily available. Provide a phone number rather than a generic email address to someone. So these are the simpler things that you can work on, and also evaluate your approach. From the start, you should have an evaluation plan about how you went in consumer engagement. And one of my favorite is, people always think about you have to go out to reach consumers, but it's always the other way around. So you have to let outsiders like me, like people who have lived experience, into your organization. So rather than you going out and searching actively for consumers, what I find it really helpful is allowing consumers to come to your organization, allow them to in your research networks, allow them in your committees. Like Htsa has an action group, they have consumers in their groups. So it's about creating the roles and being transparent about involving consumers. So what it happens is, as I mentioned earlier, if you allow more and more consumers inside your organization, they will bring in more consumers and they add value to the research. So yeah, those are the key things, as I mentioned earlier. And thank you so much for the opportunity, and I'm happy to take any questions as well.
Thank you so much, Shyam. That was such an insightful presentation. I really enjoyed it, as well as Kate. Both of your presentations were so rich in information. I love the two different perspectives that you provided, from the researcher and also from the consumer perspective. Before I jump in, there's a couple of questions on the chat. So I'd like to maybe go to those first. The first one was about terminology. So this is a debate or a conversation that we've had for many years. And it's a conversation that I've also had in the past in my background working in Canada. Should we refer to consumers as consumers, or the community, or patients, or the public? And there's such a wide use of terms used in this work. And so the webinar attendee is mentioning, why are we using consumer rather than community? And I think it comes down to the context in which you work. The context in which you work. For example, we work a lot in health and medical research, where the main funders, MRFF and NH and MRC, refer to it as consumer engagement. So we follow them, those broader organizations. So we follow them, but we also take into account that some people prefer to be referred to as community. I just wanted to see if Kate or Shyam have any opinions in this matter, or if your organizations or your groups have actually taken a stance in this as well. But just to remind everyone that this is, I guess, an ongoing conversation, and it really depends on your own context of work. So I just wanted to get a feel from Kate and Shyam.
Yeah, I've got to agree with you, Agustina. We've talked about this in our own group, and people have different perspectives. I don't think anyone, regardless of the term, no one not everyone is completely happy with it. So there are pros and cons, and you know, I think that's how it is, isn't it? That there's no consensus, and we just kind of use the one that seems to fit best depending on context.
Mhm.
Yeah, I think my mentor and my role model, Anne McKenzie, puts it bluntly, saying we get so bogged down by these terminologies, but rather than looking at the bigger picture, because everywhere, as you mentioned, both there is a patient, consumer, community, war, survivor, expert by experience. You can put multiple terminologies, but at the end of the day, as I mentioned earlier, the relationship, the trust, those are the, no one talks about these things in building those things, but because if you build a trust and a relationship, it doesn't matter what you call them, because at the end of the day, it's being respectful and taking their opinion as well. So I think researchers, I would say, like, don't bog down with these terminologies. If a consumer wants you to call them by a patient, just go by it. If they want to be called by a consumer, go by it, rather than sticking to a guideline. Or I know when it comes to publication and grants, you have to stick with it, but it's all comes to how you tackle this respectfully and getting consumer input again in that as well, how they want to be addressed. That's it.
Thank you. Thanks to both. There's another question from the chat room, and I also invite other attendees to write questions in the chat for both Kate and Shyam, or to after we respond to this following question, to unmute yourself, and I welcome you to ask your question. But the next question that we have in the chat is around reimbursement. So I really like that you both touched on reimbursement as being, you know, the best practice. Essentially, we're acknowledging people's expertise, lived experience, and contribution to our project, just as we would any other stakeholder around the table. So it's, you know, considering and valuing the input that consumers and community members bring to our projects. The question here is to Shyam specifically. What are your thoughts about reimbursement for community members being involved in research? Are current reimbursement, I guess, policies actually disrespectful, as they are often so tokenistic?
Yeah, so it comes again with often the health and medical research or the reimbursement in research based on the state you live in, and also the part of the work that you do, whether you're in a focus group or you're in a co-investigator. And we had this chart earlier as well with National Health and Medical Research. Even if you're an associate investigator, there is no opportunity for you to get paid, rather than if you're being a CA, you get an opportunity to be paid. So, and obviously in some areas we need to work as a group, and that's why it's so hard to have a standard guideline to pay a consumer, because even within consumers, some of them don't want to get paid because they see it altruistic in their opinion. But as an organization or as a researcher, it's obviously better to get consumer what they want to know, like what they want or how they want to be reimbursed for their activity. Some people want to be acknowledged in their research work, saying just put them as an acknowledgement, or some people wants to be paid for their time. And also it's being mindful of, like, for example, people often have to park, people have to travel somewhere where it's making them easy and accessible. And also if people are attending conferences, it's about paying for their carers, paying for childcare, because they have to do a day of attendance, and it's not only making the registration free for them, but also paying them to attend, because they have to sacrifice an entire day and they have to have someone at their home to look after the child as well. So it's about being, as you mentioned, Belinda, being more respectful towards the consumer needs and more tuned to the consumer needs. And also, obviously, we need to work on the policies and the framework. How do we make sure it's same across the state, and also same and depending on the consumer who are involved and the time they put in, how do we pay them valid. Yeah, those are the things. Yeah.
Mhm. In South Australia, SA Health has a policy for reimbursing consumers and community members, and at Summary and Health Translation SA, we base our reimbursement policies on the SA Health. So we try to encourage our partner organizations, which include all the universities and the LHMs, to follow those guidelines as well, so that it remains uniform across the state, and that there's no disparities between one organization and another. I just wanted to see if anyone else on the chat had any questions for Kate and Sham. I just wanted to touch on a few things that Kate and Sham mentioned. I guess probably more as comments. I really like that you both mentioned, being aware of the language and the jargon, and ensuring that we're reducing the barriers to engagement. Making it accessible and easy for consumers. And that's something that I try to remind researchers as well when they ask me, oh, I'm trying to engage with consumers and community members on my project. Well, it's something that we need to reiterate often is, make it as easy as possible in terms of, don't include acronyms every 3 words. Make your meetings flexible. What are the different ways of joining these meetings? Are there different times that you could have these meetings to ensure that it is something that is accessible to a wide variety of consumers and community members? Do you have any comments about that? And does the room have any comments, additional comments or questions for Sham and Kate?
I think that asking consumers to review a grant proposal can be quite daunting. And I know, if I'm reviewing a grant proposal about genetics, I really have no idea what it's about. It's not my field. So I sometimes think, providing like a 2-page summary or something more in kind of lay terms to still convey kind of the intention and the work is better, because it, reduces the workload and it's more accessible to the person. So maybe just one thing to think about.
In addition to that, I have been to conferences where it was a bit of not a rule, but I guess it was a rule for that particular conference to have a more of a lay summary slide before each presentation. So rather, because they had invited community members and consumers to the conference, rather than just going into the really, biomedical presentations, actually having so what's this research? What does it mean? What have you tried to do? And then actually jumping into the presentation. So it really brought the whole room to the same page. And the feedback from the researchers, even at that conference, was that actually the colleagues also understood what other colleagues were talking about, because sometimes, what you're researching, but your colleagues might think what you're doing is a bit obscure as well. So by having that, it not only benefited the consumers, but also like everyone else. So it brought everyone to the same page to understand the research. Have you both, in terms of your experiences engaging in, Cheyenne engaging in research and Kate engaging with consumers, have there been like types of engagement or methods of engagement that have been, I guess, more fruitful than others? Like, what have been experiences that have, I guess, contributed more to the research than others?
I think, well, I seen like in my field, especially in kidney disease, I think it's from top down, like rather than consumers going and asking about research. As I mentioned earlier, the leaders in those fields literally encourage consumer participation rather than just saying, because often what happens is during the grant writing period, you will see hundreds of callouts for consumers, and then it will be a lull for another 6 or 7 months, and then consumers go out. So it's about what's your intention is, like why do you need consumers? Because I often see, even in some grant committees I sit on, like you can read easily whether they are tokenistic or they are meaningful, because it's not a measurable one. when you do the consumer engagement, often the researchers also struggle. How do you create an impact? How do you measure the impact? But in my opinion, where the measurement comes is how many consumers you can engage easily, and how many consumers you're creating as leaders, so that you don't have to do a job every time you to put an application, because most of them consumers then become leaders on their own, and they bring other consumers into the organization. So I think that's valuable. So first identify a couple of consumers, talk to everyone, and then choose them, and then train them, and then give them skill set, respect them, and then bring in more consumers. That's the way of working as well. Yeah.
Thank you. Did you want to add anything, Kate, or?
I just think that actually sustained relationships is the key, because I think the first time you work with anyone, whether it's a researcher or a clinician or whoever, you're slightly, you go into it a little bit kind of, not really knowing each other. And then the more you know each other, the more trust, the more open you are, the more willing you are to give each other kind of constructive feedback. So I think that kind of developing those ongoing relationships does result in more meaningful and useful kind of collaboration.
Thanks. I also agree. It's all about the relationship building, the trust, and the, the increasing communication between each other and so forth. I guess that brings our webinar to a close. I just wanted to share this slide, which is our upcoming webinars. So next week at the same time on Thursday, we have 3 projects coming to share their experiences with consumer engagement. They're in 3 very different fields. One is in mental health, but I guess, mental health. The second one is lived experience. Well, also in mental health, but it's a very different project. And the third one is a group who partners with Aboriginal communities, and they actually co-lead the project together. The following week is all about evaluation. I get asked about that a lot. How do I evaluate engagement? How do I make sure it's meaningful in my project? And then the last webinar is we have a panel of consumers and researchers and grant reviewers talking about what's important in a grant application. So what do reviewers look for around consumer engagement when you're applying for a grant, which is a requirement that we're seeing more and more. So they want to see, how is it being done? Is it being done well, truthfully, meaningfully, etc. So please join us for those webinars. I'd like to thank Kate and Sham for their time today. I think they were really great presentations. And if you're interested in seeing this webinar again or sharing it to your networks or colleagues, this will be put on the Htsa website before next week. So thank you to everyone who's attended, and we'll see you next week. Thank you.
Thank you.